Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome back to the Low Carb MD podcast. We have the epicenter of low carb here today, Tro. You know that, right?
I'm so excited. About this. About 2 weeks ago or 3 weeks ago, I received something in the mail which was so monumental, such a huge milestone for our field, Brian, and all of our fields here today in metabolic health. I received the first textbook on metabolic health and ketogenic diet therapies, published through Elsevier in collaboration with Nutrition Network and over 40 authors. And there was part of me that got a little bit of goosebumps. And there's a part of me that's got a little bit of goosebumps right now. And I am so honored to have here Dr. Kajee and Tamzyn Murphy, who is a registered dietitian. And we're going to be talking a little bit about them and their work at the Nutrition Network, their collaboration with the SMHP, which both of us are part of, and the amazing things they're doing. And just a little backstory on both of them. Tamzyn has a master's in nutrition and is a registered dietitian. And Dr. Hassina Kajee is a internist who did her training. I had it here and now I don't have it anymore. Just as a doctor, I can't read my own handwriting. She's a practicing internist with a particular interest in the family unit and preventative care. And they've both volunteered with the Nutrition Network. And I feel so honored to have you both here. I have to be honest. I don't usually say that with so much emotion, but I feel like the Nutrition Network is this amazing beacon that has been so immensely helpful. And we work, the SMHP works with the Nutrition Network so closely and so intimately that we're just excited. Everything you guys do, we feel like it's like, our older brother just did, our older sister just did. We're just proud and happy to have you here.
Thank you so much. We're so honored to be here. So honored. Doctors Brian and Tro, thank you for having us and giving us this opportunity to speak about our work.
Well, thanks for coming. You're the gold standard. The training, the courses I've had the honor of leading a couple of the courses or giving lectures as part of it. It's amazing what you're doing. I mean, just all the different areas of medicine and society, what we can do to help other people. And the other thing that people don't talk about enough is what Prof. Noakes and his team has done, going out into the communities and trying to help the most underserved people around. So I would love to open just talking about the mission of what Nutrition Network's doing and really about the new textbook that came out that's groundbreaking. Who wants to start? Doc, you can start.
Yeah. So firstly, I just want to say thank you so much. You're both so kind, and you do so much work in this field. And regarding the textbook, it is certainly not a standalone. Yes, we edited it and collated it, and but it would not be possible with the entire global low carb community. It really wouldn't be possible. And the real gold of the textbook is just looking at each chapter and each section, the hours that people have put into it. And it makes it so wonderful to have a question, look in the glossary, look in the index, find the section and read about it and have access to those reference papers if you want to go more, in depth. But it certainly isn't something we can take complete credit for. It is something that Nutrition Network, just to pivot to that, was created. It was the aim was to bring the global society together. I remember working at Critical Care Hospitals, part of UCT, and it was so difficult because you were alone in that medical community. As both of you know, all of you know, treating people with chronic disease, and you know there's a better way, and you're not able to put it into practice, or if you are, you're shut down. And then reading, and you feel completely alone in your little world, and you search for the next book that's been published. And I realized that there's so many people out there in the same boat. So why are we not having these journal clubs together? Because we can't talk to our colleagues that we know. It's a completely new space. So really the Nutrition Network started, the brainchild was to train doctors, because the Noakes Foundation was getting a lot of requests. Can you refer me to a doctor in that area, in this area, in New Zealand and the UK? And we realized that we didn't know, we needed to just bring everybody together. And then as we started, we developed the training for doctors only. And what surprised us and threw us was the number of, we were inundated with requests from the non-medical community. So we had a growing community of doctors and healthcare providers that were doing our training, and we were also learning from them because they were experts in their field, ophthalmology and obstetrics and gynecology, that sort of thing. But then we had the general community saying, I'm non-medical, but this has changed my life and I need to learn more. And I've helped my mother and my father and it was almost the same story over and over again. I'm doing work in the community. I need to learn more. Please, won't you, is there something we can do? And so that led to the development of the training for advisors and nutrition coaches, because as practitioners, we realized that we needed coaches to help us to be able to treat those patients. So really that's where it started. And we're very grateful that it's grown. We're very grateful for the contribution that you guys have played, and all of the doctors in this field, all our friends of Nutrition Network around the world. We wouldn't be able to do it without you all. So thank you so much.
Thank you. Tamzyn, what do you have to say?
Well, I totally agree with everything Hassina has said. I feel like, yes, we started for healthcare professionals, doctors, as well as dietitians and nurses, and it's great that we've branched out into the coaches. And I think that our lectures and trainings were so crucial because there was nothing else like it, and I think there still isn't really. You want something that's credible, that has been accredited by health authorities over the globe, and that's something Nutrition Network gives a practitioner. You can you can investigate a course that's in your area of interest. So let's say it's obesity, or if it's diabetes, or you're just interested in learning generally about a ketogenic diet. We slowly but surely building on those, but there's a course for hopefully eventually everything. But I think there was nowhere else for practitioners to go to learn that. We had to, I know how all of us did it, I'm sure, as we did the same way. We scoured the literature ourselves. And for me, I was actually working as a dietitian in a nutritional supplement company. I was involved in the research and development of nutritional supplements for 6 years. And at the same time, I was an editor and a contributor to one of the leading health magazines in South Africa. And during that experience, I got to be exposed to more of the cutting edge literature, if you will. It was, suddenly there were things like in South Africa, this Banting diet that Prof. Noakes got splashed all over the headlines, and all the dietitians, we tend to be quite a conservative lot, although I must say we're becoming less and less conservative. But I think traditionally we're quite a conservative lot, and we were definitely taught these kind of things were fad diets. And I was much the same. And when my health magazine that I was editing said, we got to cover paleo, we've got to cover this Banting diet, and I was thinking, these are fad diets, you're going to kill people. But it's my responsibility to fact check them and make sure we don't put anything out there into the public that's going to be detrimental to people's health. And so that's exactly what I did. And luckily I wasn't swamped by patients back to back where I didn't have time to go in and research. I was being paid as an editor and a fact checker to make sure that what they were saying in these articles was correct. And I was even paid to write my own ones and contribute. And so I was paid to research and figure out what the truth was, what was actually appearing on PubMed, on Google Scholar. And that's when I realized, wow, there's actually a lot of literature out there for this, and it's not so much a fad diet. And, you know, this leads me to kind of, I feel like had Nutrition Network not stepped into this role of offering trainings in more of a bite-sized way, that healthcare practitioners who are actually back-to-back seeing clients and don't have time to research, like I had time to research, I was paid to research. Most practitioners don't have time to research. And the sadness is then, before it was made packaged in a bite-sized, evidence-based, accredited format or training, then what do? You listen to the authorities, and unfortunately the authorities lag years behind with regards to evidence-based practice, as we all, I'm sure, have found. So I think that's why I feel so privileged to have come on board with Nutrition Network. At the time when it launched, I was busy wrapping up my master's degree with the Noakes, funded partially by the Noakes Foundation, in which I investigated type 2 diabetes and therapeutic carbohydrate restriction, a pilot study with 30 people had put themselves onto the diet and had gone into remission. And obviously, you know, we captured their bloods back retrospectively. We went back and looked at what their doctors had measured and the bloods that they had measured when they were diagnosed and where they were now, you know, and they were in remission, obviously, which is because that was our eligibility criteria. But you know, then I was lucky enough to leave that and come on board with Nutrition Network and become part of the training that we do. But then that wasn't enough, because, as you said, what about the written text? You know, where's that? That's where I think the textbook came in. And I think, you know, organizations such as yours, the SMHP, with all the ongoing education is also vital, and it adds as another cog in the wheel that ensures that we as healthcare practitioners are practicing the most up-to-date, most evidence-based science and practice, and also able to do it in a collaborative network or atmosphere, both in the way you guys do your grand rounds and the way, you know, we have a network and the way we set up. And now I think we just keep adding, you know, whether it's trainings or grand rounds or webinars or podcasts such as this, to the textbook, where we can start, you know, really providing, I think, a framework that practitioners can rely on to ensure that they are giving their patients the best care, really.
Tamzyn, I got to ask you, you know, Troy, you can jump in next, but I have to ask you, did you get blowback when you were actually favorable to the low carb ketogenic diet? When you write that first article or two, what happened?
Well, the thing is, I think in a way I was lucky, because in the media, they always want the big cutting edge contentious thing. So within the media sphere, this was great. This was awesome that I was even, you know, wanting to go there and do that. So I didn't initially get any backlash, and I was, I suppose, high on this newfound knowledge that I was gaining. I think it was only when, well, actually, so this company I was working for, the nutritional supplement company, we produced stevia supplement, and we advertised. We had what we like to do, kind of infographic advertisements where it would be referenced. And we said, eating too much sugar causes diabetes, eating too much sugar makes you fat. And we had all these claims, you know, with this picture. And then the Sugar Association of South Africa took us to the Advertising Standards Authority and tried to shut down the advert and said, this is absolutely false, rubbish claims. They're making false claims. You have to withdraw these adverts. And that's when I actually met Prof. Noakes. So I went to a talk that he was doing at one of our local universities, and I convinced my employer. I said, let me go to this talk. They said, yes, you can get time off work and go to this talk if you go and talk to him afterwards and see if he's willing to act as an expert witness against the Sugar Association with this advert. So I said, it's a deal. So I went to his talk, and afterwards I spoke to him and I said, Prof. Noakes, would you be willing, this is the advert, look at our claims, would you be willing to be an expert witness against the Sugar Association? And, you know, Prof. Noakes, he's given the chance to stand against the Sugar Association, he's going to take it. So that's how I made his acquaintance, and then eventually did my master's degree under his supervision. But I think at that point was when I started getting the kickback. It was when I started, it was against my fellow dietitians, I think, or the more conventional nutritional fraternity, when I stepped out of the media and I stepped into my colleagues, if you will. And I think that's where the backlash came from. But I think we have come so far since then. That was, when was that? 2016. And now I speak to colleagues, and it seems like no one's anti it in the way they were then. So yes, I felt like, I think that me and my fellow dietitian Bridget Surtees were the only dietitians in South Africa who were pro low carb and who were, you know, fighting this cause based on the literature. And at that stage, that was it. It was just us in South Africa. And now it's by far and away not just us in South Africa. There are many dietitians, many doctors, not as many as we want, but we're getting there, who are open to the literature, open to the clinical applications of this diet, and across the globe you see similar trends. So yes, it was hectic and stressful at one stage, but I like to think that now people are a lot more open to the literature, and they've heard a lot of what a keto diet actually can do. And then you just have to, you know, push a few articles their way. You know, if you have a referring doctor, one of my favorite referring doctors, she's like, well, she can't fight the cardiologist on putting them on statins. I'm like, no, and I certainly can't. It's out of my jurisdiction. But, you know, here's an article, and here's another article. You know, I think that way you start to drip feed your fellow practitioners and start to get them questioning. And I think that's also our role.
Yeah, I think certainly over the years, it's toned down here in the United States. When Brian and I first started podcasting, I was looking back, Brian, it's been 5 years ago we started talking, and it's about 5 years when we started podcasting. And when we first started podcasting, we had several people asking us to have our license questioned and challenged. And this is certainly around the same time as Prof. Noakes. So, but
yeah,
now we're consistently in the top 10 in iTunes in medicine. And, you know, we have around the top 20 podcasts very frequently. So certainly the message is spreading. And Dr.
Yeah.
And
the interest and the interest is there as well. I mean, the fact that you are so popular means it goes to show that, and I think this is what Noakes always talks about, is it's always starts from the ground up. It's the patients who realize before we do what really works. I'm sorry to interrupt, but when I was doing my internship and I was in the poorer community clinics, I remember the nurses saying, oh, I'm not going to eat this bread because it's going to make me fat. And I said, what rubbish? What rubbish? You know, grains are supposed to be the basis of your diet. Don't believe this rubbish. And then I'm thinking now, years later, I'm like, oh, wow, how wrong was I? Anyway, sorry to interrupt.
And but I just want to draw attention to the fact that if it wasn't for Gary Fedke and Professor Noakes standing up, this podcast wouldn't be there, because we would have shut down and go, you know what, these guys both didn't pursue it, so it couldn't be real, so we have to step back. And so, you know, their courage of standing up, they didn't have to, they could have just went off in the sunset, did research in a different area, but they knew what they were saying was correct, and so they fought it. And the reason we stuck with this podcast was, we have to show that there's doctors like Dr. Kajee out there, all these doctors around the world with benefits, and we have the patient records. We have the records of people coming off insulin and their diabetes goes into remission or cure, whichever term you want to use. But we're seeing not only that, I think the biggest surprise. Well, I'd love to hear from you two. What's the biggest surprise, the thing that surprised you the most that you see as a result of a low carb or ketogenic diet in your patients?
So, I mean, I'll start. For me, I think, you know, when you see the patient for the first time and they're terrified, because firstly, they're completely overwhelmed. They're so frustrated. You see various patients who are terrified because they've got this diagnosis of diabetes, and they nursed their mom and their grandmom, and they saw the EKA happening, the amputation, and then soon after that was death. The usual story. And then, I'm lucky because a lot of my patients are no low carb, but they've just hit like a roadblock, and they're not able to get over that hump. But for those people who are completely naive, and I just want to say, I had one particular patient working in one of our biggest hospitals, private hospitals, in Cape Town. And some of my very good friends, great doctors, people that I send patients to, work at that hospital. And she was the quality control manager, and she found me and she said, I love Dr. So-and-so and Dr. So-and-so and Dr. So-and-so, but I'm not going to them because they're going to put me on insulin. I know this. I researched and I found you, and I know there's another way. And, she completely reversed her diabetes. She used to freak out if her blood glucose was 5.4. She was like, my blood glucose, it's rising. Tell me what to do. So the biggest thing for me is in that first 2-week period. So they come to you completely naive, are not sure what to do. And then there's this magic kind of 10 days or 2 weeks when like the light bulb goes off and they suddenly know. You say to them, maybe you should cut dairy at some point, or maybe, and they're so unwilling. But then the light bulb goes off because they've experienced it. I'm a big believer in tracking. And so I say, why don't you try this and track and see what happens, And then they say, you're so right, because my sugar was all over the place. And then I gave up dairy and now my sugar's completely fine. So for me, it's the belief that every single person, every individual you're your own master. And I really dislike the way we're trained in the medical fraternity to prescribe. So you get these patients saying, doctor, tell me what to do. So I like to break that in the very first appointment, and say, I'm just here to ring little bells and to lead you back to yourself. You will know, you will get to that point where you know what's right for you. So for me, it's that light bulb moment, whether it has to do with, I recognize that I stress too much. I recognize that I don't like to exercise, but I recognize that I need to exercise, or whatever it is. I recognize that eating after 7 p.m. is not good for me, or I recognize that my sleep quality is not great. For me, it's a journey, and it's when it's not really the scale victories or the non-scale victories. Those are wonderful, but that's short term, in my opinion, because there you're just following a plan. It's when that intelligence, when they start to go, right, I've got this, and they just give you a little call here or there to say, just tell me if I'm on the right track. Then, you've won. The patient's on their way. So for me, that's why I love what I do. That's it for me.
And how did you start your journey into this? This is not how we're trained. So we're not trained on metabolic health. We have very little training, and certainly we know you've co-founded Nutrition Network. So how did you go from a practicing physician to now helping get a text booked up and co-founding Nutrition Network, and being such a pioneer in this space? So can you help me understand your own sort of transition?
So I think from childhood, my granny was very instrumental in sort of just the way we ate. We ate rice and rotis and all of that, but she was very, we didn't eat a lot of processed food. We didn't eat out much, and we didn't buy like the cakes and things like that. And she would always say, make sure she would make sure we were eating real food, whole food. So I had this interest in the way the body functions from very early on. And then when I worked, when I was doing my my registrar time, so specializing, I remember I was always interested. I just refused to believe that human intelligence doesn't exist. So I would sit with the patient, and I have, even, you know what it's like when you've got a busy clinic with like 70 people sitting outside waiting for you. But I would choose a patient and I would say, right, I'm going to take like 20 minutes and I'm going to talk to this person and just make a difference with. So I'd say, what do you eat? And this was way before. And I just would go through, they would say, I have like 2 liters of Coke a day, and I have 2 loaves of bread, and I would just say, well, you know, that actually equates to a lot of sugar that you're having. So it was that type of thing. And when I would eat, and I would eat pasta, you know, with a cheese sauce, I would go, what did I just do now? I had a lump of dough, and I had, you know, so I've always been, but the turning point for me was close to my end of my reg time, when I started to see patients coming in with myocardial infarcts earlier than the age of 30. So there was one particular guy who was 26 and his wife was pregnant and his babies were coming in, and the babies were coming in with like crisps and cool drinks, and he was morbidly obese. And it happened regularly. It started to become, and you know, and then when I was working as a specialist, this was after having 2 children, I think becoming a mother. My husband's got a strong family history of coronary artery disease. And then becoming a mother made me realize a little bit more that this is not the path I want my children to be on. I need to prevent. And I started to look at the world differently. And then I noticed that my 10-bed high care unit, many times all 10 beds were taken up by coronary artery disease, and everybody was overweight. So it was around that time. And then Prof. Noakes started to talk about this. And I thought, you know, I really respect him, but what's this like rubbish that he's talking about? Prof's really lost it this time, until I started reading the papers. And then they made absolute sense. I remember sitting across from a colleague of mine who's an endocrinologist. And I was so, I'm so sad to say this, but I was so anti-obese people at the time. What I didn't realize was I was so frustrated. I needed to solve this conundrum. You know, I didn't know the answers. And I would say, but why is somebody who's obese always sitting with something in their hand? You know, why they're always eating something? And he tried to explain to me, he was anti-LCHF, but he tried to explain to me, you know, there's a lot more going on in the endocrine system than it's not just a choice. And so it was that. And then eventually I started, I was never overweight. But after my first child, I gained probably about 8 kilos and took about, I don't know, a year to get back to my baseline weight. But after my second child, eating LCHF, like 2 months later, a couple of months later, all the baby weight was gone. I felt different. I remember I had interns or medical students working with me, and I wouldn't take a lunch break. And around 1-2 o'clock in the afternoon, they would, if on a very busy day, I remember this girl coming to me with these big eyes going, whatever you're doing, please tell me, because how can you be so full of energy? You don't take any lunch breaks, but you're still going. I can't take it anymore. And I remember when you're a registrar and you're really busy, I used to think something's not right. The human body is super intelligent. Why are we so limited by meal times? Why is it that we're great at solving all these problems, and then suddenly come lunchtime, like, do not talk to me about another patient until I eat something? It just didn't make sense to me. And then suddenly practicing LCHF, and my husband suddenly lost like 15 kilos in a matter of, you know, a couple of months. And then it was like food wasn't something you could hang in front, you know, it didn't run your life anymore. You weren't running after meal times. It wasn't the mealtime clock, you know. And then I started to read more, understand more. And then I started a clinic aligned with my high care unit. So I would see somebody coming in, newly diagnosed diabetic, and I would say, not on any meds. Okay, right. Best place to start. Let's start. And I got a lot of pushback because I had the cardiologists coming through my unit. And I was very lucky because I had a colleague and we were both practicing LCHF. So it was great because I could talk to him. And we know what a lonely field this is. And there was one particular time, and I'm adding this because you asked Tamzyn about the pushback that she got. And he had got interns to type out diet sheets. And one of my patients, he had slipped it in sometime earlier, or somebody had put that in, and the cardiologist had seen it, and they pulled us out, they tore it, and they were furious. Why are you putting this rubbish in our patients' folders? And, so hopefully things have changed. Hopefully when we can start talking about inflammation, and redox imbalance, and mitochondrial health, and we can start looking at all the factors that cause that imbalance, there's enough proof that we're all interested in health. All my medical colleagues love their patients and want the best. No one's trying to deliberately harm their patients, and that's the angle I go at. And I firmly believe that. But as Tamzyn says, when you start to approach it from a way where you're sitting actually on the same side of the table rather than across the way from each other, and that's how you start to have those conversations. But yeah, I think it's an ongoing journey.
So can you guys, it's just truly amazing. Both of you have such a curiosity about you, and you're curious about how to help your patients and how to help the people in front of you, and you're challenging sort of the status quo and looking at what's going on in front of you, and then sort of adapting, which I think that's the unifying characteristic that Brian and I have seen again and again in this community. It's this idea of being open, challenging the mantra, challenging sort of authority, being, renegade maybe is the right word. And so now, can you guys walk us through when the Nutrition Network was formed, how it was formed, and how you came to the point where now we have this landmark, huge milestone? So every listener should go out and get this textbook. Can you walk us through how we came to this point? Because I think this is a huge milestone. I'm not trying to diminish all the courses you guys have put together. I'm not trying to do that because all of them are huge milestones in and of themselves. But how did we get, where do we come from, and how did we get here?
So maybe I'll start with the Nutrition Network. So when we realized that there were so many people, actually came again from the patients, that there were so many people out there, and we only knew of a few names, your names and a few other names, Rob Sivers, and a couple of names around the world. And we realized that people were putting out their own YouTube videos and making, and podcasts and things like that. We realized, there's so much intelligence in this global room. And so as I mentioned before, we thought, okay, let's create a network, because really we want everybody to be a part of this family and not be isolated. The other thing, as I said, was from an academic background myself, I'm used to having, attending 1 or 2 journal clubs a month, and you can start to talk about the nitty-gritty stuff. And when I was working in this academic field, I was having the most ridiculous conversations with super intelligent people. And as Tamzyn alluded to before, people are so busy in their own area specializing. And I've had people, pediatric allergologists, saying, like, look, tell me the crux of this, because I don't have time to read, and, oncologists and things like that. And really it was about, we've gone so far already in this field, in the low carb community, but we're all feeling frustrated in the general medical community because people look at us like we've got just an eye in the middle of our foreheads. So what are we doing separate? Let's join. And when we join, let's start talking about the other stuff, because there's a lot that we're facing. We're facing hurdles. It's not easy. Just put the patient on a low carb diet and that's it. They're perfectly fine and they're healthy. There are other illnesses, and we need to learn and grow together. So the first the idea for the Nutrition Network actually started under the umbrella of the Noakes Foundation, and we had our big launch event, and we invited speakers, and we chose the most topical sort of topics, and we had a large launching conference, and then we released the first course, and we were just overwhelmed by the number of people who were interested. And then obviously you have to keep looking ahead. And then in time, we came up with a long sort of curriculum plan, and it's constantly revising and looking at what's topical, what do people need more information about, where is the science. Every single module has to be heavily backed by science. We're very thorough, and we're very particular about who we invite to speak. What's the need? There's need for oncology, the role of insulin resistance in cancer. Do we have enough information to service that topic? And then we got to a point where it's constantly growing, and you have to grow with your community. So we created the Nutrition Network platform, where everybody can just kind of chat and ask questions and share growth and wins and articles. And then we just, we were talking about where is this going, and we really feel that it's an academic platform. And the kind of the hurdle we faced is that people trust a textbook. Medical professionals, we grow up on textbooks, we know what it looks like. We trust the science. There's enough science. It's all in patches here and there. It's not in one big book. And the way to talk medical is to talk through a textbook. And that's where we started to have this big, almost arrogant dream. We should write a textbook. And we're like, right. And I think when we all decided that, I was sitting around the boardroom table, we were like, okay, we should do this. And it was about over 3 years ago, Tamzyn. And we said, okay, we're going to do this. And I think we all freaked out, because where do you have the time to do this? And thank goodness Jane is such, what do you want to say? Is such a great leader and able to inspire us, and Prof just believes in everybody's abilities. And it just happened. It was like an idea, and then Jane just cracks the whip, and the team just cracks the whip, and and I want to thank Tamzyn for the amazing editing job that she did, mainly. It's deep reading to go through somebody else's written work in detail and then go, this is really good. It makes a lot of sense, but could you just elaborate on this part? And I'm like, oh, I'm going to have to read like 50 different articles to make that more clear. So sorry, I've given a really long-winded answer, but it's a journey. It really, it's great now. I almost can't believe that there's an actual textbook. When I looked at my chapter in the flesh, I was like, whoa, this looks really nice. And when you compare your written article on the computer, but really it's this tiny little drop compared to, the editing work that Tamzyn has done, and all of the work of the authors, and all of the back and forth of the back end admin team, and the number of articles, and the images that needed permission, and just fact checking, and Sarah Rice, and reference checking, and so it really is a massive team effort, for the greater good, for the medical fraternity, with the hope that we can walk into a colleague's office and say, here's a copy, maybe we should start talking about this. Don't you think we should start teaching, or are you interested in insulin resistance, teaching students, medical students about it? Here's a book you can start, and there's credibility.
It's
and
amazing.
I think,
Go ahead.
sorry,
Go
Dr.
ahead.
Joe.
No, go ahead.
I just wanted to add to what Hassina just so eloquently, the story she took us through and the timeline she took us through, culminating in this textbook, and to say that it also was the perfect complementary item to go with our courses. So we have all these courses, but we needed a text to add gravitas, if you will, to what we've been doing and to what our members are getting. You know, if they're getting the course, but they need to be able to walk into their colleague's office with that textbook and say, you know, here it is, you know, in black and white, in a simple, relatively quick and easy to consume format that you recognize as a medical practitioner. And so I think it gives us that gravitas. It's the perfect accompaniment to the coursework, and it also gives everybody, including ourselves, but our members and everybody, the structure of our curriculum as well. Our curriculum is based around the structure of this textbook, or the textbook around the structure of the curriculum. Either way, they go hand in hand. But the plan is that this textbook is supposed to cover, not by any means comprehensive, in that there are lots of things that we couldn't fit into this textbook simply because we had a word count, which really irked me terribly, because there's so many more things we wanted to fit in and cover in more detail, but we couldn't. But at the very least, it covers the most important applications of therapeutic carbohydrate restriction, combined with the background and the complementary factors with it. So now you'll find as you go through the textbook that there will already be nutrition network courses, or there will be upcoming nutritional network courses that complement the textbook by the authors within this textbook, but also additional lecturers, because there will be additional topics and cover things that aren't always covered in the textbook, or vice versa, but there will be an overlap, and it's the kind of structure that we're going with, so that we can systematically cover the most important points, that topics that people that come up. So for example, now I'm going into more the structure of the textbook, and you can stop me if you want to. Do you want to stop me? Okay. So it kind of the textbook starts with the nutritional fundamentals, if you will, which is understanding human diet and disease. It's the science and evolutionary evidence behind. So what is a human supposed to eat? You know, every animal has an evolutionarily consistent diet. You know, a cat sitting here behind me, all blurred, you know, she's a carnivore. We know this. We know lions and cheetahs and leopards and pumas, they're carnivores. We know that giraffes are herbivores. But what is a human? And how can it be so easy to categorize other animals, and yet apparently so hard to categorize ourselves? And, you know, we go into that. We go into what humans should be eating, and then start diving into the anthropological evolutionary evidence, and then diving into the science of it. So it gives you the background of building the case for therapeutic carbohydrate restriction from an evolutionary and scientific perspective. And then is the big crux of the textbook. And that is what in dietetic spheres we call medical nutritional therapy, but it's basically the therapeutic application of diet in clinical practice. And this is where we've covered the big things that doctors and dietitians and nurses will encounter. So like diabetes, you know, non-alcoholic fatty liver disease, cancer, all the therapeutic applications of, well, not all of them, as I said, I wish it was all of them. I wish there'd been enough space, which is why this is edition 1, because there are more applications that we just didn't have space to cover. But the key ones, you know, Dr. Kajee covered, you know, thyroid. And I know, Dr. Lenz, because you were involved with the deprescription of medication, that chapter as well, with colleagues. And, you know, I think all the main things that a doctor would need is in this textbook, and it is a perfect accompaniment to our courses, either that have already come out or that are about to come out. And then it ends kind of with the considerations after you've dealt with cancer and you've dealt with neurology, Alzheimer's disease, which is type 3 diabetes. I'm sure you've covered that already on your podcast. You know, immunological factors, which again, we didn't have enough space to delve into, but hopefully in addition to, we do. Gastrointestinal, and again, we need to delve into that in so much more detail as well, but space was restrictive. At least there's enough for practitioners to now look at and apply in practice. And then we ended off, obviously there's health and fitness and fasting as well that's covered, but then we end off also with other considerations that all practitioners should have, psychological considerations, including addictive considerations. Again, we didn't go into it in enough detail in this textbook. We do touch on it, but we're going to need more. So this is why edition 1 is definitely the place to start, but we want to grow this. We want to grow it alongside our courses. And then the ethical considerations, legal considerations, if you think of Dr. Fetke and Prof. Noakes, what are the legal considerations? How do you motivate for behavioral change? This is another thing that as healthcare practitioners, we've been teaching ourselves. None of us learned the psychology of how do you actually get this patient in front of you to want to change. You not just spew forth information at them and send them away with a prescription. Starts delving into that, and these are really practical techniques that are covered by the likes of Dr. Jen Unwin, where she gives us. I read this section, for example, and I was able to apply it the next day with my patients effectively. So I really think, and all of us do, that this textbook is supposed to be easy to use, relatively comprehensive within the constraints of textbook size, well referenced and evidence-based, and just easy to refer to. You've got a cancer patient, what do I do? Turn to the cancer chapter. Okay, fasting and chemo, I want to know about that. Or I want to know about what is the metabolic basis of cancer, or I want to whatever it is, deprescribing medication, type 2 diabetes, type 1 diabetes. You turn to the chapter, you can turn to the sections, and as textbooks are, I've realized they're always too short. Really, there's so much more to know, but it is very well referenced. So if it's too short for you, please check the references, and you can go down many, many, many rabbit holes. So I think this was the logical complementary aspect to our courses. And similarly, as we go, the courses are logical complementary aspects to the textbook that hopefully we can grow a proper, we've already got a curriculum, but grow it and continue to move with the science and not become these old tomes that academic institutions and textbooks often end up becoming.
Yeah, and from a practitioner standpoint, when we're looking to refer out to a nutritionist or a health coach, when they say they were trained by Nutrition Network, we say, okay, cool, like we got it, like you understand this stuff, because it's so thorough and it's so in depth. My own office manager is trained through Nutrition Network, right? So she knows all this stuff just because of her training doing that, and it's practical training. It's stuff that you're going to see in clinic, so it's very, very helpful. And for people interested, how do they get the textbook?
Yes, so you can get, sorry, Hassina, you go ahead.
So there is a link, I'm not able to share it now, but via Elsevier. And then I think there's another link on Amazon. But I wanted to also say that you spoke about people being trained. What we realized was, people can do the standalone courses, but we're very lucky that this community, really the thing that it's given is the sense of community. I spoke to a doctor from Greece a couple of weeks ago who wants to do our certification training. So our certification pathway is a lot more in depth. We've got 2 different certification streams. One is for coaches and the other one is for medical practitioners. And really that's to make sure that you've done the modules, but you really understand it. And so we really take you through the ringer in a 3-month program with, in a multiple choice question entry, and then live weekly sessions, question and answers that you have to reference an answer on the platform, and then an assignment of your choice, case study of your choice, assignment or case study, and then finally a live oral exam with 2 or more practitioners. So we've got those 2 streams. So I just wanted to also say that a lot of people have applied to do that, and to become part of the community, because what you said just now, Brian, was when you say trained by Nutrition Network, that's what we wanted. We wanted when somebody says, can you refer me to somebody in Texas or wherever, We need to be able to say, I know this person, I've interacted with this person, I will give this person a stamp of approval without a doubt. I'm happy for you, because that's very important to us, the safety, knowing your scope of practice, and whether the person is, a lifelong learner, whether none of us are experts. I mean, I don't believe, with all due respect to all of you, I think we're all lifelong learners. And that's what you want. And so that's what we want to see. And that's something that I forgot to mention, that the modules led to the development of this certification pathway. And the great thing is that that community engagement is just so great that people are going on and doing other great things, like publishing articles on diabetes reversal and starting their own YouTube channel and just getting a lot more confident and developing in their own expert spaces. And this is what happens. We're not here to just blow our own horn. We're here at the end of the day. Central to this is the patient. And honestly, we need to work quickly. And that's why we're so grateful that there's so many practitioners, because we need, somebody said, I think it was Dr. Lustig, and we were interviewing him on a panel, and he said, I've come to just accept that I'm never going to see change in my lifetime. And I refuse to accept that. I want to see change in my lifetime. And we are seeing change. And I love Dr. Lustig.
I think that's a joke. I'm sorry. That's a complete joke of a statement. Can I just say one thing? I don't mean to interrupt, but we have, here in the United States, we are using the Nutrition Network and their standard as the pathway for certification through the SMHP, right? We have created a physicians organization in the United States, a not-for-profit, that uses your standard, what you've created, as the standard. We will soon ratify the textbook as our official textbook. We have, and we're building on what you've created. Okay, we're building on it. We have now officially, we have an indexed journal. We have the Journal of Metabolic Health, who Prof. Noakes was very helpful to have that help sort of orchestrate all of this. And we will soon have AMA PR1 accreditation for every single module, including all the new Nutrition Network modules that we require, like the ethics module, for example. So to say we will not see change in our lifetime, look at this. We have the first physicians organization focused on metabolic health in the United States. We have the first Journal of Metabolic Health affiliated with that organization. We have a textbook. We have a certification pathway thanks to the Nutrition Network and all of its supporters. And to say we have not seen change. I've seen more change in the past 5 years than I've seen in a long time. And I'm proud to call you guys across the pond allies and friends and coworkers and colleagues. And so I'm going to have to say boo to Dr. Lustig's statement.
I may have completely oversimplified what he said, but I think, just the whole global policy change and that type of thing, I think he was just trying to say, it's long game. Yes, it is. But you can see change within a week. You can see change immediately in a day if you're looking at CGMs and glucometers and things like that. And I'm just very glad that to be affiliated with you guys and all the work that you do, because this is something, we needed to start like decades ago. And, thankfully the work.
Oh my God, you guys are giving me goosebumps, because this is exactly what, Dr. Laura, myself, Brian, Doug Reynolds and all the board at the SMHP, which, this is exactly what we're talking about. This should have been done, a decade ago. And, but you know what? Some of us have to do the work. And I view you guys as like our, if you guys are the Avengers, we're like the X-Men, you know what I mean? Like, I'm so honored that you guys came on today, and I'm so excited. I have the textbook, reading through it. Every page is like a page turner. And if you're listening right now and you haven't gotten this textbook yet, we will put the link. You should go get the textbook. Certainly, about Nutrition Network and their and their courses. Most of our listeners have done many of those courses, but go check it out. They always have new courses out. And how do people get a hold of either one of you if they wanted to talk to you more about dietetics, or talk about the Nutrition Network, or talk about your practice? How would they get a hold of you guys?
So all of
Was
our email addresses are end in the same thing. So it's at nutrition-network.org. So that's at nutrition-network.org. And then our first names will come before the at. So in my case, it's Tamzyn, Tamzyn, at nutrition-network.org. And in Hassina's case, it'll be Hassina at nutrition-network.org. And similarly for anyone else in our organization, the same rules apply.
That's awesome. Brian, why don't you close us out?
Yeah, no, I'm just so thankful for Professor Noak, Nutrition Network, all that you're doing, and just bringing the community to get together. And, I've been in recent months really looking at the effects of lifestyle, stress, not sleeping, and all these other things. Is not just what we're eating, but how we interact. And I think one thing I've noticed through Low Carb USA and a lot of the conferences we have is that when people come together, it is so much fun, and people are like, there's other people like me struggling with certain things, and that they're not the only one. So I think over the last couple of years, we've learned the importance of community. So what Nutrition Network's doing and what Tro's doing of getting, having meetings where we can have a bunch of people sharing notes and comparing, saying this is what works, here's what doesn't, because otherwise it's all theoretical until we see patients benefit from it. So many things that as doctors and in the nutrition field, there's so much stuff that's just taught to us, and we go, that's true. And then you go, it's not working. It's not working. We were doing the ADA's recommended diet with our diabetics, and they're getting worse. And I was doing it and getting worse. I'm like, there's something wrong here. It's not working. So that's what I love about that. We can all, have a textbook now where we can look, and it will change in 2 years. We may have we changed our chapters and things will change, but right now it's the gold standard. So for people learning and who want to do well by their patients, they can learn from all the experts who've been doing this for the last 20 years, some of them, So I think it's just it's just really important what you're doing. So we're glad to be a support, and hopefully a lot of people will order the textbook, and we could all be on the same page and learn and grow and get better at treating patients.
Thank you so much. And the other thing I want to add to that, Brian, is that, and Tro, is that there's this hierarchy in the medical field in general, but in the low carb space, it's just a community. Everybody's just happy to learn from each other, and and that in general, that's my experience, and I think that's what makes it work. It's everybody just willing to chip in and help each other and share the knowledge. So thank you both for fighting the good fight and for all that you're doing.
Yes, I just have to reiterate that. Thank you so much, and thank you for having us on here. And it was great to be able to actually connect with our brothers across the sea. So thank you, and keep doing wonderful work, and we'll keep looking forward to our interactions and our collaborations.
Thank you both so much.
Thank you. Bye.